Good morning and welcome back. Well, whether you want to get rid of them just to look a little better or they're causing some serious medical problems, there are treatments available to correct varicose veins. And here to talk about that this morning from Gunderson Health System is Dr. Kevin Schoepel. Dr. Schoepel, thanks for waking up with us this morning.
No problem. Glad to be here.
So varicose veins is the topic of what we're discussing. And I guess, could you describe, many people know what they look like, but can you kind of describe medically what's going on there?
Well, veins direct blood flow back to the heart, and veins have valves in them. Two leaflets that direct blood flow back to the heart, and over time these valves can go bad. And actually the two biggest reasons of valvular destruction or the valves going bad are pregnancy and genetics. So it's two things you can blame on your parents and your children that they gave you. So.
And we talk about there's both cosmetically people might want to get rid of them to look a little better, but they can also cause some serious problems. What are some of those problems?
Absolutely. So, 10 years ago when I started doing veins, I kind of got forced into it, but then I learned that these people are suffering, and they're one of my most happiest patients. But achy veins, heavy veins, tired veins, I think a lot of people describe this as old age. I've had several people come in and say, my wife made me come in, my legs are just tired, heavy, it's just old age. And you treat them, they say, holy cows, my legs really do feel better. It's like taking off an ankle weight, or people describe it as walking on feathers once you get rid of these big achy veins.
Yeah, and what are some of the treatments available to treat these big achy veins?
Yeah, and so in the last 5 to 10 years, we've replaced vein stripping. It's that was available the last 50 years, painful procedure in the hospital. We've now at Gunderson are doing the laser therapy, endovenous laser therapy. So instead of removing or pulling this whole vein out, we put a little catheter inside the vein, a laser fiber, and we essentially turn it on and burn it, or I think of it as shrink wrapping it. Basically gets rid of the vein inside the body through a small needle stick. And this prevents the blood from traveling backwards through this vein because of the bad valves. And then they don't engorge large, achy, tired, heavy legs. So pretty neat treatment. People do really well with it.
And this will help people feel better and look better as well, correct?
Absolutely. I mean, my push is always make your legs feel better. There are some cosmetic veins, smaller veins, but this is more for symptomatic veins, for tired, heavy, achy legs. They feel better, and as a good side effect, they actually look better too.
And just real briefly, we're running out of time here, but can you tell us kind of when does it become a problem? When should people consider coming in for this procedure?
I think that if there is a concern that your legs are tired, heavy, achy, an ultrasound can help us determine if you have veins, or if you see big veins in your calves or your thighs. Certainly doesn't hurt to come in and get it checked out.
All right, some good information there this morning. Dr. Schoepel, thanks so much for joining us.